Milwaukee Mayor Tom Barrett, Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of Medical Services at Milwaukee County Office of Emergency Management, Darren Rausch from the Greenfield Health Department. We also have an update on our featured guest speaker. It will be Dan Pojar, EMS Division Director for the Milwaukee County Office of Emergency Management, joining us to talk about staffing at the Miller Park Centralized Community Testing Facility. County Executive Crowley, you're up first.
Thank you so much, Cindy, and thank you all for joining us this afternoon. I want to touch briefly on yesterday's decision by Milwaukee County District Attorney John Chisholm not to pursue criminal charges for the Wauwatosa police officer Joseph Mensah in the shooting death of Alvin Cole. First and foremost, our hearts and prayers remain with the Cole family as they continue to cope with the loss of Alvin. But I would like to say that municipalities must act quickly to adopt the tools and best practices that increase police accountability, like body cameras. We can't put a cost on human lives or on delivering justice to communities of color. We must put our money where our mouth is and take the steps to invest in the protection and success of our Black residents. The impact of centuries of oppression can't be undone overnight, but the time for change is always now, and there are steps that we can immediately take to increase police accountability, better serve justice for Wisconsinites, and possibly save lives. So for individuals partaking in opportunities to express their voice, please remember the 3 W's, which is watch your distance, wash your hands, and wear a mask. It is important to be heard, but it's equally important to keep yourself and others safe and healthy. And so I want to remind you that during these trying times in our country and in our community, Milwaukee County has resources available that can help. The Milwaukee County Behavioral Health Division has a 24-hour crisis line that is staffed by clinicians who can help if you or someone you know is struggling. And please don't hesitate to call. And the number there is 414-257-7222. Also on Tuesday, the State of Wisconsin Department of Health Services issued the 3rd emergency order, which limits the capacity of certain indoor facilities to 25%. I am proud of and thankful for the actions taken by our county departments and elected offices to reduce their in-person footprints and really adapt to the critical services to virtual environments whenever possible. And while there is an exemption listed in this order for state and local government operations in our facilities, it is important that Milwaukee County does its part to flatten the curve as the COVID-19 cases surge across the state. And for this reason, where we can, we will be following the 25% capacity limit. Essential services that cannot meet this capacity limit will be exempted. But starting today, this means that indoor public-facing non-essential services or facilities, including our Milwaukee County parks, our county zoo, and Willow Way facilities will be limited to 25% capacity. We do not anticipate any impact to essential services, including our courts and our transit system. And we do not expect the reduced capacities to have major operational impacts, as the county has already been erring on the side of caution and public safety with our current administrative order and reopening plans. But also want to make sure to thank businesses who have voluntarily taken these steps to reduce their capacity to help their employees and our community be safe. Our state is also experiencing a surge in COVID-19 cases, and we all have our part to do in order to stop this spread. And so I'm really grateful for the partnership between the city of Milwaukee and Milwaukee County to open up a centralized testing facility at Miller Park. Not only will it increase our testing capacity and ensure that COVID-19 tests are available at no cost to those not showing symptoms, it also creates new job opportunities. In just a few minutes, you'll hear from Dan Pojar from the Office of Emergency Management, who will share more information on the staffing needs for the facility. And in regards with the appeals court ruling, the absentee ballots must be returned by 8 p.m. on election day. I would like to say that it is an unfortunate decision, especially with it being made with less than a month to go until the election. But I want to let folks know that we're going to do everything in our power here in Milwaukee County to encourage everyone to vote, but more importantly, make sure that every ballot is counted. And I'd like to turn it over to Mayor Barrett and thank him for his leadership.
Thank you very much, Mr. County Executive, and thank you for your leadership as well. I concur with the statements that the County Executive said about the announcement yesterday by DA Chisholm and my condolences again to the family. This is a difficult time, and it's a time when all of us have to re-examine our relationship with everyone else in our community, and certainly take a look at law enforcement. And as the county executive said, it's important that different municipalities move forward with police cameras, with psychological testing, with de-escalation training. I'm pleased that the city of Milwaukee instituted body cameras many, many years ago. I'm pleased that we instituted a practice of having applicants for the police department undergo psychological testing. And I'm pleased that we've developed programs for police officers when interacting with individuals with mental illness. And I say all that knowing that we in the city have a long way to go. I am not in any way suggesting that we have figured this out, because my view has always been that relationships between the community and the police department are a relationship. That means you have to keep working at it, and you have to keep trying to make it better. But it's a challenging time, and I think it's important for people to remain peaceful at this time, particularly those individuals who are exercising their First Amendment rights. I think that's very, very important. I want to talk a little bit about the whole situation with the National Guard. As I said earlier in the week, we are going to see a transition. I'm again thankful to Governor Evers and the National Guard for the months of partnership that have been extremely strong and have allowed us to test literally tens of thousands of individuals here in Milwaukee and the surrounding area. We understood all along that there would be a transition. As we said earlier this week, you can expect on Monday, so just 4 days from now, 2 additional sites to open up for COVID-19 in the city of Milwaukee, one being the Northwest Side Health Center, the other being the South Side Health Center. So there will be 2 additional sites opening up on Monday. A week from Saturday will be the end of the testing, the National Guard testing at UMOS and Custer Obama. But that's not something to fret about, because less than 48 hours later, a new site will open up at Miller Park. And as the county executive said, this has been a wonderful partnership with the city, with the county, with the state of Wisconsin. And the National Guard will continue to do a transition through November 25th in helping us open up both the Northwest Side Health Center as well as the South Side Health Center and Miller Park. So our actual capacity will grow. Our ability to test individuals will grow. I think that's important. In addition, our mobile testing unit will have expanded capacity from 100 to 300 tests per day, because we know how important testing is, and we remain committed to testing. And I think that this is something that the community has responded well to. And all you have to do is look at yesterday's numbers, where we had 1,582 people at UMOS get tested. We had 754 people at Custer Obama get tested. So for the week, we've had just under 7,000. We've had 6,927 individuals get tested. And I think that that's very, very positive. The city of Milwaukee has recorded a total of 22,428 positive cases and 290 deaths as of today. And that's way too many from my perspective. But we continue to do everything we can to lessen the impact of this pandemic. As we look at our key indicators, seeing as it is Thursday, there's a little good news to report. We are at 3 yellow for cases, for PPE, and for tracing. But 2 of our categories, testing and care, are at green. Now, whether they stay at green is one question. The testing, I'm confident about. The cases, and Dr. Weston may talk about this more in depth, we are certainly seeing a very dangerous surge in hospitalization, particularly in the Fox River Valley, in the northeastern part of the state, in the central part of the state. That is what led Governor Evers to announce the opening of the alternative care facility at State Fair Park. And my view all along on this has been, I wanted this to be a situation where we had this alternative care facility there if we needed it, but I prayed and hoped that we would never need it. Now, with the surge that we're seeing in the northeastern part of the state and Fox River Valley, it appears that we will need it. So we'll be continuing to work from a local level with the state and the National Guard to make sure that we're doing everything we can to have that up and running. Another point I think that's relevant here is our average positivity rate is 6%. We would like this lower than 5%. We would like it at 0, but we certainly would like it less than 5%. It has been higher than that in recent days. And so I'm pleased to see it starting to come down. At least that's my read on it, is it's starting to come down. And we're seeing a lot of tests. We're averaging 2,680 tests per day. And that's a lot of cases. I mean, that's a lot of tests. That's a lot of tests. As I mentioned, we are seeing surges across the state. And I'm grateful that our mitigation efforts here locally have helped keep our numbers fairly steady. And I say that without any arrogance or any overconfidence, because I know how quickly this could change. But from day one, we took this very, very seriously. Closing down the bars and restaurants the day before, or basically essentially on St. Patrick's Day, our safer at home order, the mask ordinance, which is widely accepted by the public right now, and I think has been very effective, all have been tools that have allowed us to, relatively speaking, keep this under control. Right now in the state of Wisconsin, we are in a bad place. We continue to be in the top 5 in both the per capita number of cases and the total number of cases. That's not where we want to be at all. But within the state of Wisconsin, Milwaukee continues to be in the lower part of the state, and we're approximately number 52 of the 72 counties. We would like to be 72 out of 72, and we'd like to have 0 cases throughout the state of Wisconsin. But I would certainly like to see our positivity rate continue to go down. I think we all recognize that we need people to be committed and do everything they can to stop the spread of the virus, especially as we enter these colder months. The county executive made reference to the emergency order number 3 that was issued by Governor Evers just 2 days ago on October 6th. That goes into effect today throughout the state of Wisconsin. And under this order, local municipalities are permitted to have orders that are more restrictive than the Wisconsin Department of Health Services order. And as many of you may know, to protect residents, the city of Milwaukee moved forward some time ago. The city of Milwaukee Health Department created the Moving Milwaukee Forward Safety Order, which provides a phased-in approach at combating the pandemic. Moving Milwaukee Forward Safety requires restaurants and bars to submit a 54-point COVID checklist to the health department in order to operate beyond the 25% that will be covered by those who don't. The checklist requires businesses to implement hygiene, cleaning and protective measures, policies, and procedures. The local order also requires businesses to facilitate remote work to the greatest extent possible, ensure individuals remain 6 feet from others whenever possible. So it was a decision of the opinion of the health department and the opinion of our city attorney's office that our local order is actually more restrictive than the state order. So even though our local order permits for some locations, not all locations, but for some locations, gathering of individuals more than the governor's order, the additional restrictions listed under our order do prevent COVID-19 transmissions, we think, more effectively. But we continue to work with the governor's office. We continue to work with the state to make sure that we're aligned, because I applaud the work that the governor's doing on this. We believe that it's important for us to work together, and we're going to continue to try to do everything we can to work with the state and to do everything we can locally here as to what is most effective. We are committed to doing everything we can to reduce the spread of this disease, and we want to use those measures which are most effective, and that's what we're going to continue to evaluate. So it's possible that some of these things will change. Right now, again, if you are not one of those establishments that has submitted a plan, you are going to be limited at the 25% in conjunction with the state order. But we're going to continue to work with businesses to make sure we're doing everything we can. The county executive also made reference to the situation where the court just in the last hour has now changed the rules once again as it pertains to absentee ballots. This is the frustration we faced in April, where we had courts going back and forth and back and forth. And I think it does a huge disservice to our residents when we have the courts issuing order after order after order that keep changing the landscape for the election. But I can assure you that we and the people at our election commission are doing everything we can to make sure that voting is going to be safe and accessible. You can visit myvote.wi.gov or milwaukee.gov/election to get connected with all the necessary information to make the best plan for you. I am not pushing a specific plan because some people want to vote absentee, and we're doing everything we can to make that possible. We've had well over 100,000 people who have requested absentee ballots, and we've had over 40,000 of those returned. Please, if you want to use the mail, but make sure it gets there before November 3rd. But also take a look at these safe boxes that we have at 13 locations throughout the city, primarily at the libraries. Those are cleared out every day. There's a security system monitoring those. They've been very, very popular. So if you're not comfortable in putting something in the mail, that's a place to do it. But remember, based on the court order that was issued literally hours ago, those all have to be in by close of business on November 3rd. Voting absentee not only protects you, but I think gives you an opportunity to have your voice heard. If you don't want to vote absentee, again, we're going to have the early voting sites, 13 early voting sites. That is technically absentee balloting as well, but that is in-person early voting. So that's one other way you can do it. And on election day, the last number that Claire shared with us was 173 different polling locations throughout the city. So again, you can return your absentee ballot up until election day. If you return it to one of our 15 secure drop boxes throughout the city, or again, feel free to vote on November 3rd. So a lot's going on. It's a busy time, and we appreciate all the teamwork that we've got. And with that, I'll turn it over to Dr. Weston.
All right, thank you, Mr. Mayor. Good afternoon. First to our numbers, we've had 31,157 confirmed cases of COVID-19 in our community, and 437 individuals who've died. As we see the struggles around the state with hospital capacity and the opening of the alternate care facility, a site we certainly hoped we would never have to use, questions naturally arise as to our own Milwaukee County hospitals and how we're doing. To be sure, our current hospitalizations are following a poor trend. In just 3 weeks, we've seen more than a doubling in the number of patients hospitalized with COVID here in Milwaukee County, from 77 to 165, a higher number than we've seen in 4 months. Now, that aside, we're lucky in Milwaukee County to have multiple health systems in several large hospitals. Furthermore, back in the spring, health system leaders joined together to create plans to expand their capacity to better ensure high quality patient care for more patients than they'd normally be able to take. And finally, we have the release valve that is the alternate care facility to provide even more capacity for patient care. Each of those items, each of these plans that were put into place months ago and kept in place with an unpredictable future in mind, have and will continue to serve our community well. Considering the transmissibility and likelihood of severe illness of COVID-19 in many communities, however, we must be mindful that this health system infrastructure can only continue to function if each of us are to continue to slow the spread of disease. As the county executive outlined, we're back to the flatten the curve concept that we talked about in the spring. And the way to do that is to take personal precautions, continue physical distancing, continue mask usage, and be mindful of the safety of the activities in which you engage. 2 other quick reminders. We continue to recruit EMTs and paramedics for part-time positions for our core team, which will work at the community testing sites. And you can find more information on the Milwaukee County Office of Emergency Management website or Facebook page. So I will stop there. I'll also encourage anyone with symptoms of COVID-19, those with close contacts, those who've tested positive or referred by a public health practitioner to get tested. And one last reminder, in addition to our large community testing sites, we have the 16 healthcare and community health testing sites as well. And those can be contacted through calling 211 or visiting testupmke.com. Thank you very much. Stay safe, and I'll hand it to Director Rush of Greenfield.
Thank you very much, Dr. Weston. It's my pleasure to join this afternoon to give a quick update on the data that we're seeing for COVID-19. Just going to go ahead and look at the data here. There's 3 different figures you see on the screen here. On the left, we reflect the overall Milwaukee County COVID burden. So these are daily cases with the line representing the 7-day average. The orange line is the city of Milwaukee. The blue line is the Milwaukee County suburbs. So you can definitely see that we are in the third peak, but we are at levels that we, not quite to levels that we've seen before. So we're inching up, but certainly we're still under where our most recent peak was in mid-July. On the right-hand side of the screen here, I just want to flag that the case increases in the children. So these are the data for the children's report. So at top, we have 18 and under, and the bottom graph is the 17 and under age group. And I just want to point out that we see a very similar pattern. So when the community numbers go up, the numbers in our children go up very consistently across both the county, the suburbs, and the city of Milwaukee. And that's an important clarification to share. So I'm going to spend the rest of my time kind of delving into the whole county report, specifically talking about that data. Again, we are on an increase. It looks like we're going to continue to have a lot of cases in the next couple weeks, and this is something that we're going to closely monitor and look at that peak that we're seeing. As of today, the drivers of COVID cases in the state of Wisconsin continue to be other parts of the state, particularly the northeastern part of the state and the northern part of the state, but every county in the state seems to be at a high level of burden or a very high level of burden of disease at this point. Our deaths in Milwaukee County have been remaining fairly consistent. Deaths has been a lagging indicator, but that's certainly something that we've reported and we continue to reflect here. A pretty consistent level of deaths since the early part of July. I want to talk next about the reproductive number. We've given this a lot of attention over the last several months. And one thing I will point out that on this graph here, when we look at the reproductive number for Milwaukee County, we have seen a significant increase since the beginning of September. Some of that might have been related to end of summer activities. Some of that might have been related to Labor Day festivities. Some of it might have been related to schools and colleges and university reopenings. But we had significant transmission in the early part of September, continuing into the middle part of September. More recently now, our transmission rate is below 1, and that's important because that means we are suppressing disease. And similarly, when we look at this data and compare the city of Milwaukee in the top figure versus the suburban communities in the bottom figure, we're seeing similar trends where we were above 1, but a more pronounced period of time where the reproductive number was above 1 in the city of Milwaukee. Other trends for this week are very consistent. We still continue to see a large growth in our 25 to 39-year-old population. We continue to see cases surge in the white population amongst all others. So we continue to watch that. Hospitalizations is an issue that we've been tracking as well. We continue to see more hospitalizations with increasing age, and the rate is very important, and that rate is age dependent. So the older a person is, the more likely they are to be hospitalized. Similarly, we see a same age pattern in deaths, and I will announce today that we have added additional lines for deaths in the 18 to 39-year-old population, as well as the under 18 population on this graph. I'm happy to report that as of today, we still have no deaths in our under 18 population. However, we have seen about 10 deaths throughout the duration of COVID-19 in our 18 to 39-year-old population. We have up until today suppressed that data to keep confidentiality and privacy laws in check, but we do reflect that. And again, while deaths are small in that age group, deaths are occurring in the 18 to 39-year-old age group. Granted, again, the older you are, the more likely that somebody may pass away from COVID-19. Switching gears now to talk about testing. We had been on a downward trend in testing throughout July and August. I'm happy to report that through September, the testing numbers did go back up. The most recent week here looks like it's down, but I know we have a number of tests that tend to lag in terms of results, so they tend not to be reported here. But testing up is a good thing. That means people are accessing testing if they have symptoms, if they're concerned about COVID-19, and that's what we want to see. We want to see people accessing tests in our community. We're not seeing any changes significantly in any trends, however, in Milwaukee County. And while percent positivity remains low, has been mentioned before, we're not seeing any significant trending in that area. Lastly, we'll talk about a couple of the maps. This map is talking about the entirety of the new cases of COVID since March through early October. As you can see, we do have and do reflect cases of COVID throughout the county. More recently, when we look at the last week, we can really zoom in on some of the hot spots, and we see that the areas that are red have some of the highest case rates for COVID within the last week. And this includes much of the east side, much of the central part of the city of Milwaukee into the southern part of the city of Milwaukee, and many of the southern and western suburbs. So these are areas where disease has really been increasing over the past week. Lastly, we talk about testing rate, and when we talk about testing rate within the last week, I continue to want to point out that we have pockets of the county, particularly those in blue and green, where we have low rates of testing, and we certainly want to encourage everybody. And Mr. Pojar will be following me to talk about some of the new testing sites that will be coming up, but really want to encourage people that testing is available and to get testing, because there's many people, according to this map, who aren't getting testing for COVID-19. So with the data today, we continue to see that our cases are increasing. And while we have yet to reach the peak that we saw in both April and July, this is very concerning. As we look at the data and we think about this third peak, I want to continue to note that disease rates have been very significant in other parts of the state. And due to these rising cases, we need to continue to do the things to keep us safe. The 3 W's: wear a mask, watch your distance, and wash your hands. But also, I want to point out that your cooperation, the residents of Milwaukee County, your cooperation is important for public health to really intervene and public health to work to control this disease. So think about these 3 concepts. Number 1, if you test, please quarantine until you get results. We have seen time and time again, people who've gotten tested have returned to work, have returned to school, and then their test results come in the next day, and that increases the need for quarantining either workplace or school contexts. Secondly, if you test positive, please follow the public health guidance of isolating for at least 10 days until the symptoms resolve. Provide the information requested by the disease investigators and contact tracers, and obey the isolation directives. All too often, my staff are reporting to me, and colleagues are saying the same thing that's happening in their jurisdictions, that people are refusing to comply. And this frustrates us in public health, and it also frustrates our ability to respond to COVID-19 in our communities. And lastly, if you've been exposed, heed that public health guidance on quarantine for 14 days. I understand it's not an enjoyable experience and you probably don't want to be at home, but quarantine is one of those very important measures to limit the spread to others. Seek a test during your quarantine period if you're symptomatic, but remember, you can't test yourself out of quarantine. All of these measures and all of these concepts are very important to controlling the disease, along with the 3 W's. And we know that cases are surging in many other areas of the state, and that's why increased testing and the opening of the alternative care facility will be happening here within the next week in the Milwaukee County area. So please continue to exercise care in preventing disease transmission wherever you are and wherever you may be. And I thank you for your time and attention, and I'll now turn the briefing over to Mr. Dan Pojar.
Thanks, Director Resch. I just wanted to provide a quick briefing on some of the staffing requests that we are going to request from the community today. But first, I wanted to start off by thanking the National Guard for their response. It's really important to recognize the good work that they've done for our community. But as we all know, as COVID has really grown throughout the state in terms of cases, it's time for the community here to stand up and assist with our own community so that the National Guard can go focus on some other areas within the state. So the Milwaukee County community testing sites are going going to be stood up. We all have heard about the Miller Park locations, and then the county executive and the mayor have also referenced the MHD locations on the northwest side and the south side. So multiple positions are currently available that we're trying to recruit for. And it's all ranging from specimen collection to registration and education roles, and also support and logistical roles. So some of these are medical positions and some of them are non-medical positions. For the medical positions, luckily, the qualifications needed are widely variable. It can be anywhere from the emergency medical responder role all the way up to the paramedic. And from the nursing side, it could be from the medical assistant all the way up to the nurse. The non-medical positions that are currently available do not necessarily require a license, but obviously there would be some just-in-time training and on-the-job training to provide the education to the patients that we are serving. With the positions that are currently available, there's a mix of full-time and part-time. The positions all start at $15 an hour minimum, and the compensation increases with the different levels of tasks to be completed. So a lot of specimen collection roles are making usually in the neighborhood of $25 an hour. I think I've already addressed the training. The on-site training will be provided. There will also be an oversight, which will provide a safety net through a quality assurance role to ensure the patients are getting the correct information. People can find information if you're interested in applying on the Milwaukee Jobs website at milwaukeejobs.com. And there's also the Milwaukee County Career site, which is the OAM site, and the OAM Facebook page all have links to the core team jobs, which Dr. Weston has mentioned as the internal county team. And with that, I will turn it back over to Sydney. Thank you.
All right, thank you, everyone. I am not seeing any questions in chat yet. Do we have any questions for our panelists? Our first question comes from Allison Durr at the Milwaukee Journal-Sentinel. Mayor Barrett, Governor Evers told us today that he's concerned about your announcement last night as it relates to the city's enforcement of the city's COVID order over the state's order. In particular, he said he's concerned how it could affect Milwaukee and the state healthcare system. What is your response? And are you at all concerned that the governor's office will challenge the city's decision? What guidance should businesses act on?
We've had good conversations with the governor's office. We explained to him, explained to his representatives that the Milwaukee order really creates a different category. And under that category, bars or restaurants have to submit this 54-point order that needs to be approved by the city of Milwaukee. And in doing that, we feel that that actually creates a safer environment. But we certainly are going to continue to work with him because I think we're on the same page. I think we all want the same thing and we're all working towards the same goal. So it's not a situation where I view them as in conflict. I think we're trying to get to the same goal and we're going to continue to have the dialogue. I see our commissioner has gotten on, and Commissioner Jackson, anything you would like to add?
I would just add that I would agree with you, Mayor, that we are all on the same path to making sure that we reduce the spread of COVID-19. And we feel that our order and the safety plans that have been put in place really define in very good orderly fashion the work that each restaurant and bar has done and has implemented to put those steps in place so that we do absolutely slow the spread.
Thank you, Commissioner Jackson. Our next question comes from Mark Stevens at CBS 58. This is for Dan Pojar. Dan, how many people are you looking to hire at the testing facility?
Yeah, thanks for the question. To start off, a pretty large group of people. The numbers are still a little bit in the works as we figure out the staffing model, exactly how we want it, and to make sure that it's the most efficient for serving and also as safe as possible for the patients.
Our next question comes from Graham Kilmer at Urban Milwaukee for the mayor or anyone else who can answer. What specific parts of Milwaukee's order make it safer to be in an enclosed public space with more people than the governor's order, which requires a person to be in a space with less people?
I'll let the commissioner or Claire Evers respond to that? They're the ones that work on this on a daily basis. Claire, maybe you want to take that one.
Sure. So the COVID safety plan that we have restaurants and bars complete, it's really thorough. So it includes elements such as talking with their vendors about how they are going to comply with social distancing, with sanitation. It also talks about how they're going to notify and quarantine staff if they become COVID positive. And it also talks about the layout of their facility and how they handle separating tables and space and the flow of their staff. So anyone who's worked in a bar or restaurant knows, kitchen spaces are really small. So we talk about their food flows. We talk about how they're going to adequately space and effectively run their establishment. Our purpose in setting up these COVID safety plans was to find a way to coexist with the virus, knowing that it's going to be around for a while. So it is much safer to go to an establishment that may have a higher capacity, but they are employing all of these safety measures, than to go to an establishment that may have less capacity, but are not putting all of these mitigation strategies into action. And so it's much safer to go to an establishment that has thought through these 54, these 50 plus measures and are following them than it would be to go to an establishment that is not taking COVID safety seriously.
Our next question comes from Allison Durr at the Milwaukee Journal Sentinel. To follow up on the COVID order, about 1,800 businesses must provide these safety plans to the city, according to the health department, but only 318 had been approved and received as of Friday. Doesn't this mean the vast majority are still functioning with a 50% capacity limit?
Those businesses that have not submitted a plan will be at the 25% level in accordance with the governor's order.
Our next question comes from Rose Schmidt at CBS 58. If a Milwaukee business owner is operating at 50% capacity, should they continue doing that, or should they fear punishment for not capping it at 25%?
Again, if you have not submitted a plan, a safety plan, the governor's order of 25% will cover your establishment. So the answer is you should be at 25% unless you fall into this special category.
Our next question is from Sari Lesk at the Milwaukee Business Journal. 1, would you describe the trends you're seeing locally as a surge in hospitalizations? 2, where do you expect patients at the state fairgrounds to come from as the alternative care facility starts service? And 3, will Milwaukee area hospitals be accepting patients as part of the opening of the state fair facility?
Yeah, so taking those stepwise, as far as describing the trends we're seeing locally as a surge, I think in Milwaukee County, we're certainly seeing an increase in hospitalizations. I think it's a concerning increase. As I mentioned, it doubled over 3 weeks. However, we are lucky in Milwaukee County to have the large hospitals, the large health systems that we do. So I don't think we are by any means pushing the capacity of Milwaukee County, but it's going to be a trend to keep a close eye on. As far as patients for the state fairgrounds, where they'd be coming from, I think that'd be a question for the state who's kind of coordinating the alternate care facility. I'm not quite understanding question number 3, whether Milwaukee area hospitals would be accepting patients. Our Milwaukee area hospitals are certainly always accepting patients, but the alternate care facility is to kind of a pressure relief valve for lower acuity patients from hospitals that are reaching their capacity.
Thanks, Dr. Weston. Our next question comes from the Shepherd Express. For the commissioner or the mayor, the statewide order will still apply to City of Milwaukee retail stores, correct? Since the Moving Milwaukee Forward Safely plan is specifically for bars and restaurants, not other public businesses.
I can take that one. So the governor's order does exempt a large amount of establishments that would fall under retail establishments, but those that are not exempted would be required to follow the governor's order. And so if any establishment is questioning whether they fall into that exemption, they can email askcovid19@milwaukee.gov, and we can look at the exemptions and see if they fit in.
Our next question comes from Jessica Battle at WISN 12. We're seeing a record high number of cases statewide today. The CDC has had us at number 3 in the state, as the number 3 state in the nation for new cases in the last 7 days for some time, behind only Texas and California. Why are our case numbers so high? What are we doing or not doing that is different from other states?
So I think it's hard to say exactly why Wisconsin's numbers are so high right now, but I think there's a number of different factors, somewhat of a perfect storm of factors that are coming together. We initially saw the increases in colleges and universities. That's certainly spread well beyond those boundaries. We're seeing spread at the community level throughout the state of Wisconsin really now. More focused in certain areas of the state, but throughout the state, we're seeing troubling trends. I think it's a combination of a few things. I think it has to do with school and university reopenings and the kind of downstream effects that we've seen there, especially colleges and universities. Even though we're now at community spread, I think certainly the colder weather makes people gather more indoors where we know it's more dangerous for the spread and transmission of COVID, and cold weather inherently makes the virus more easy to transmit as well. And then I think Wisconsin was lined up with this cycle that we seem to be seeing where there's a high number of cases, people tighten up complacency and the cases kind of go down. And then people become more complacent at an institutional level as well as an individual level. People become more lax, cases start to rise, and then we tighten up again. And we seem to be, much like every state and regions of the country, going through that sort of cycle. The problem with the cycle is each time we go through it, a lot of people get sick, and unfortunately quite a few people die. So if we can hopefully slow that cycle, it's much like flattening the curve. We need to slow it down and remain complacent, even at times when we seem to sort of flatten things out a little bit.
Our next question is from Sari Lesk at the Milwaukee Business Journal. The first part of this question is for the commissioner, the health department, or the mayor. Does compliance with the city's restaurant bar plan remain complaint driven? How do you ensure those places that submitted a plan are following it? And then the second part of the question would be a clarification for Dr. Weston. So we'll get to that question in just a second.
Sure. So the compliance with restaurants and bars is complaint driven. However, we also do routine inspections at all restaurants and bars. So during those routine inspections, our inspectors are also looking, in addition to looking for Wisconsin Food Code compliance, they also are looking for our COVID safety plan compliance.
The second part of the question is clarifying the question regarding the alternate care facility. If other facilities are at capacity, are patients going to be moving from central northeast Wisconsin, where they are at capacity, to Milwaukee County facilities?
Well, first, I think I may have just said we need to remain complacent. I meant we need to remain vigilant. But as far as where patients are moving, what hospitals are sending them to the alternate care facility, that would certainly be a question for the state. I don't know all the details on who's coming to the facility at this time.
Are there any other questions from media? Please place them in the chat. I think that's it for us for today then. No further questions. Thanks everyone for joining us today. We will be back here again next week on Tuesday. Thanks everyone.
Thank you.